President Trump just this morning announced a major move. He is going to slash drug prices effective immediately. He says we could see 59 to 80% cuts. We could even see as much as a 90% savings. This is incredible. So for those of you on Medicare, you need to pay attention to what President Trump is proposing at this time. But also, people that work in the health industry need to pay attention to what is going on as well. And anybody that uses prescriptions, no matter what it is, you need to pay attention because President Trump says we are paying way too much and he wants to bring prices down so we are competitive with other countries. Now, I'm going to break down what President Trump said today, what this means for Medicare, Medicaid, and private health insurance companies moving forward. But what you need to keep in mind is this is a big move because now the Trump administration is admitting that prices are out of control. So I'm going to break all this down in just a moment. But first, before I do, all I ask is one thing. Takes 2 seconds. Go ahead, hit that like button if you enjoy these daily updates. And now, let's begin. So more than 67 million Americans are enrolled in Medicare. This is a substantial number. This shows a good portion of our country is enrolled in Medicare. But what Trump is planning to do is a big move. Look at this. It says Trump signs order aiming to cut some U.S. drug prices to match lower ones abroad. Now, what exactly does this mean? Well, let's read it. It says right here, Trump signed an executive order including several different actions to renew that effort known as the most favored nation policy. He did not refer to specific nations, but signaled that he would target other developed countries because there are some countries that need some additional help, and that's fine. Says, basically, what we're doing is equalizing, Trump said. We are going to pay the lowest price there is in the world. We will get whoever is paying the lowest price, that's the price we're going to get. What he means by this is the United States government cannot afford to keep paying the $1.9 trillion. That's what we paid last year for, I believe it was for Medicaid and I think for Medicare. Okay, for those two programs. $1.9 trillion in fiscal year 2024. That's quite a bit. Now, what we've seen in the past, and I'll just show it to you, right? It's no secret. Congress was trying to cut Medicaid. They were trying to reduce the size of Medicaid, reduce the expense, because we cannot keep this up as a country. So what did the Trump administration decide to do? Because President Trump said, we're not going to cut Medicaid, we won't cut Social Security, we won't cut Medicare, we will not cut the essential programs. Okay. Now, how do we go about doing that? How do we go about not making cuts at the same time reducing the size of the federal government? Simple. Let's just cut the costs, right? Cut it out from the retailer, from the healthcare companies. That's what they're saying. Now, I want to keep reading this to you. It says White House officials did not disclose which medications the orders will apply to, but said it will impact the commercial market as well as Medicare and Medicaid. They said Monday's announcement will be broader than a similar policy that Trump tried to push during his first term, which only applied to Medicare Part B drugs. Just so you know how much people are paying if you are not currently on Medicare. But Medicare costs, if you're on Medicare Part A, this is the hospital insurance, this typically is $0 a month. It can go up, depending on income, it can go up to $500+ a month. Medicare Part B, this is medical insurance. It's average about $185 a month, okay? The annual deductible, I believe, is like $250, $260, okay? So could we bring the annual deductible down if we reduce the cost of Medicare? Yes. If prescriptions are cheaper, we can bring the deductible down. We can also bring the average, the monthly premium down from $185. We've done this in the past where premiums didn't continually go up. It dropped down one year, and I believe that was last year. Then it ticked back up again. Medicare Part C, this is Medicare Advantage. It's, I think, $17 a month. It's under $20. And then Medicare Part D, these are the prescriptions, and these are $46.50 on average per month. Okay? Again, 67 million people are on Medicare. This is a substantial amount of money that Medicare is bringing in to cover the costs associated with providing health care to 67 million people. So what President Trump is proposing is no cuts to Medicare, no cuts to Medicaid. But what they're going to do is they're going to bring down costs. Now, there's some pushback here. Here's what you need to understand, though. President Trump wants Medicare to pay less than foreign countries. Here's the reason why I said if you are in the healthcare industry, you need to pay attention. If you receive any type of medication, you need to pay attention. It's because of what some people are arguing is, illegal. Look at this. It says, in a statement on Monday, the pharmaceutical industry's biggest lobbying group, PHRMA, lauded Trump for taking aim at other nations not paying their fair share. It says still, PHRMA's CEO Stephen Ubel said, importing foreign prices from socialist countries would be a bad deal for American patients and workers because it would hurt the industry's ability to bring them new treatments. Some experts have said the order could face challenges from the pharmaceutical industry in court. Now, this was a shock to many of these pharmaceutical companies that they had no clue what was going on. So essentially, President Trump is saying you're charging too much. We are going to reduce your the sales price of your products. Essentially, what that means is these companies will be less profitable. And if they're less profitable, that means they also can't put in more money into research and development. They can't hire more employees, right? There's going to be some pain along the way. But in the end, President Trump says, well, we have to do it because prices are getting out of control. It's just too high. Many people cannot afford the medication that they need to keep them safe and alive. Yeah, it's a huge problem. Now, I want to just read something to you. Look at this right here. It says Trump signs executive order that aims to slash drug prices by at least 50%. It says the plan won't be limited to Medicare prescriptions, but will also target medications covered by Medicaid and private insurance. Weight loss drugs are expected to be on the list. Yeah, so Ozempic, right, Wegovy, right, these different semaglutides, they're going to be on the list, which means instead of paying $1,000 a month for a weight loss drug, maybe, just maybe, it's going to be $200 to $300, meaning more people can afford it, meaning more people will lose weight, right, be healthier, which means if more Americans are healthier, then our prescriptions, our health care costs, everything goes down. And if we have more money per month to spend on other things like healthy food, utilities, just buying something as a consumer, well, it's better for the U.S. economy that we're not just propping up the healthcare industry, but the entire economy as a whole. Now, I want to leave you with one last thing. When President Trump says that we have been paying too much, he means it. But how does this go through? The concern right now is that, yes, President Trump, he wants to sign this executive order, but according to experts, this may require a move from Congress because Congress is going to have to dictate how much these pharmaceutical companies can actually charge for certain medications. Not only that, they are the ones that are going to be responsible for tying the United States' certain medications to specific countries. But based off of what we've seen with tariffs and the negotiations there will likely be a flat fee. Okay, so if some company decides they want to overcharge, that company is going to have to pay a fee to the United States government in order to charge the American people said price. So we're going to see what happens moving forward, but what I can tell you right now is there's a lot of changes on the way. The one thing that is happening, President Trump is doing what he said he would do. He would make it easier to afford things here in the United States. He's bringing jobs back. And like we saw today, the stock market is going up. So we'll see what happens, but that's what we know as of today. So again, thank you guys for watching. Consider subscribing, and I'll see you guys on the next one.